question. Is a heart rate of 100 normal or concerning?
Before I answer that, let me ask you a question. What was the heart rate 4 hours ago and 2 hours ago?
Why does that matter?
Because it changes everything. Hey, a heart rate of 100 by itself could totally be fine. But when a heart rate's been climbing for a few hours, that starts to show us a pattern. And patterns tell us a story about what's happening inside the client's body. I'm Ashley.
And I'm Martha.
And if trend questions on the Next Gen NCLEX make you break out in a cold sweat, then you're in the right place. This is the Nursing Navigator.
Nursing Navigator's here. Wipe away those study tears. Hearst Review's got your back. Listen close, stay on track.
Studies show that nurses who check 3 time points catch deterioration 85% faster than nurses who don't.
Wow, that is not a small difference. I mean, that's like the difference between picking up on a problem early or running around because your patient's crashing.
Exactly. So what most nursing students do is they look at a set of vital signs and they just ask themselves, is this normal or is it abnormal? But what safe nurses do is something different. They look at the story, the entire story that the numbers tell over time.
Oh, so today we are going to show you exactly how to do this using this NCLEX trend question and a practical tool that's called the 3-point comparison rule. And guess what? You could even use it in clinical tomorrow.
Awesome. So let's dive in.
Let's do this. So, Ashley, let's look at this NCLEX trend question that we have and walk us through. What do we see here? What's going on?
Okay, so here's what's on your screen. We have a 78-year-old female client who is admitted at 0400 with pneumonia. She's alert and oriented, has some crackles in the right lower lobe, and was started on levofloxacin 500 milligrams IV at 0600.
Okay, so typical pneumonia patient, right?
Right.
And they're on antibiotics. So what do we do now?
Okay, so what we need to do now is look at the vital sign tab. This is where the trend comes in. So at 0800, her pulse was 86 and the temperature was 100.2 Fahrenheit. And for our Canadian friends, that's 37.9 degrees Celsius. But at 1200, 4 hours later, her pulse is now 100 and the temperature is 101.2 degrees Fahrenheit, which is also 38.4 degrees Celsius.
Okay, so in other words, the UAP has come to tell you those noon vitals. And so based on this information, what do we do? I mean, what interventions are appropriate then?
Right, and this is really where a lot of our students make the mistake. Okay, they make a mistake here. They look at the pulse, which was 100, a temperature of 101, and they think, okay, yeah, that's slightly elevated, but it's still okay.
Well, yeah, because if you just look at those numbers by themselves, I mean, they're not that bad.
That's right, exactly. But this is what safe nurses do differently. They see something different. They recognize a pattern. See, what happens is that the heart rate has climbed by 14 beats. The temperature is rising by a full degree, and both are moving in the same direction over a 4-hour window.
And this is happening after the antibiotics are started.
That's right. She's been on levofloxacin for 6 hours at this point. So this is not just slightly elevated. This is an evolving problem that needs action.
Okay, then. So how does a safe nurse know which patterns to actually follow? I mean, which ones matter? What's the difference between a normal variation and something that we need to worry about and do something about right now?
Yeah, that's a really good question. This is where the ACT method comes in.
Okay, so in case someone didn't hear a previous episode, AG, break down what that ACT method is for us. How are we going to work it into this question?
All right, so we've got ACT, A-C-T, and that stands for Ask Why, Connect the Dots, and Think Ahead. So basically, this is like a secret weapon for clinical reasoning. And what we want to do is we want to show you guys how this is going to apply to our patient with pneumonia.
Oh, I'm ready. Let's go.
All right. First, ask why. So why is the heart rate going up? Okay, why is it up from 86 to 100? Then why is the temperature climbing from 100.2 to 101.2, even though she was started on antibiotics at 0600 and now it's 1200?
Okay, so that's a good question because she's been on antibiotics for 6 hours. So shouldn't she be getting better?
Yeah, see, that's what students think. That's what they think. But here's the why, okay? Because, understanding that why is so important. The body's working harder. It's working harder than it ever has. It's fighting infection. It's trying to cool itself down. The heart's pumping faster, trying to meet the increased needs of the client. So we don't just accept the numbers. We need to understand what's driving them.
Okay, that makes sense. So that's the why.
Right.
But what about connecting the dots?
All right, so what's the relationship between all of those changes? So we kind of can think of this like an equation. Okay, and I know that's not fun because we don't want to do math. We're not fun. Like that's not fun. But we're gonna do an equation here. So rising fever plus rising heart rate plus a patient who's flushed, shivering, and slightly restless equals what?
A worsening inflammatory response.
Got it. There we go. Okay, there we go. She's not getting better yet. She's getting worse. And the infection is still ramping despite the fact that she's on antibiotics.
Okay, so what you're saying is she's on the right medicine. It's just her body is still struggling because of the infection.
That's right. And so that brings us to another step. We need to now think ahead. So if this pattern continues, what do we think is going to happen next?
Well, her body's going to work even harder.
Yes, that's right. Okay, so her body's workload is already increasing, and her oxygen consumption is rising. She's already got compromised lungs from having the pneumonia. So what we have to think of is, what do we do now to prevent further complications?
Okay, so if we're going to prevent further complications, we need to support her body while the antibiotics are doing their job.
That's right. That's right. So we're going to do all the interventions that reduce fever, decrease metabolic demands, and support her system. That's basically the ACT method in action.
Okay, but now I'm wondering this. How many time points do we actually need to identify a real pattern versus a normal fluctuation?
That's another good question. And this is where that 3-point comparison tool is really going to help us.
So this is that practical tool that everybody's been waiting for.
Yep.
AG, break this down. I'm ready.
All right, so you got your 3-point comparison rule. And basically what it says is always compare at least 3 time points. Baseline or admission, post-intervention, and then current.
Okay, so why 3? Why not just 2?
Because 2 points will show you a change. And that's good. That's good to compare. I want to know if something's changing. But 3 points show a trend. And that's exactly what type of question this is too. And it's going to let you know, is this client getting better? Are they getting worse? Or are they staying the same? And that's what all 3 points will tell you.
Okay, so since you said we have to look at 3 points, what are the 3 points in this question?
Okay. Point 1, that's upon admission. And the admission was at 0400. All right, and then point 2 is at 0800, which is 2 hours after the antibiotics were started. And now we've got some vital signs. You got your pulse was 86, your temp was 100.2. Well, that's good information, but what's next? So point 3 is current, and that's at 1200. And that's 6 hours after the antibiotics were started. And look at those vital signs. Pulse 100, and then temp 101.2.
Okay, so between points 2 and 3, what is that telling us then?
Yeah, the trend is worsening. Okay, this client is not getting better. The numbers are climbing. The client's not stabilizing. And this patient is not responding to the antibiotics yet. Okay, and that's actually normal in the first 24 to 48 hours because, her body's under increasing stress.
Okay, so with that then, this is telling us that she needs interventions, right? We can't just wait and see. So what are we going to do?
Right, exactly. In your clinical rotations, this rule is really helpful because it helps you document the trends, but it also helps you do things like communicate concerns to your provider with specific data points that you can give so you have something to say. And then most importantly, it helps you to recognize when you need to act versus when you can just monitor safely.
So how then are we going to use these 3 points to be able to pick what the right interventions actually are? I mean, in this question, we got 7 options to choose from. So how does it all come together? How are we going to figure this out?
Yeah, that's what we need to connect next. All right, so here's your big picture. You see that you have a trend question. And guys, when you see a trend question like this one on the NCLEX, you are not just reading numbers, okay? You're reading a story.
Oh, I love that. Reading a story. Yes, looking at the big picture.
So if you use the ACT method at every step, you're going to ask why. Okay, so ask why the pulse went up from 86 to 100 and the temperature from 100.2 to 101.2. Then connect the dots. Rising fever plus rising heart rate plus antibiotics started 6 hours ago equals a worsening inflammatory response that needs support. And then think ahead. Guys, if we don't intervene, her metabolic demands are just going to keep rising and she could deteriorate further.
And then we apply the 3-point rule. Is that right? Okay.
That's right. Okay. We saw the vitals at 0800. We then know that the antibiotics were started at 0600. And now it's 1200. This just means that the trend is worsening over time. That pattern tells you which interventions make sense.
Like what?
Well, we're going to administer an antipyretic, and that's going to reduce the fever that the client has. Apply damp cloth for comfort cooling. Cover with a light blanket to prevent shivering. Maintain room temperature at 80 degrees. All of these things are focused on reducing the metabolic stress while the antibiotics work.
Okay, so that makes sense, but what doesn't make sense is those other options, and here's why with those, because don't we need to look at why even with those?
Exactly.
Okay, so why the 1,000 milliliters? Well, that's not a lot, right? She's got increased demands.
Yeah.
She needs more than that. Okay, the other one that doesn't make sense is those blood cultures. Well, girl, we all know you get blood cultures before you start the antibiotics. And those antibiotics have already been started. So, nope. And then the other one that just doesn't make sense here, so it wouldn't be a correct answer, is going to be the low-calorie nourishment because this person, their body has those increased demands that we've already said. So, they're going to need more calories because they have increased metabolic needs, right?
That's right. All right, so let me give you guys one other practical takeaway. The 3-point comparison rule. You need at least 3 time points, okay, not 2, but 3 to identify a true trend. Remember what 2 points will do. 2 points will show you that there's a change, but 3 points shows you direction.
This is perfect. In fact, I want to encourage you to write this down. Get you a sticky note or something, okay? Write it down. Use it at clinicals tomorrow or in your shift tomorrow because when you're looking at a patient's chart, go ahead and ask yourself, what were their vitals when treatment was started? How much time has passed? And what are they now? So start practicing it now.
Yeah, do you guys remember that data that we shared earlier about what happens when you do the 3-point comparison? You're able to catch deterioration 85% faster.
That's crazy.
Isn't that wild?
That's a lot.
That's a lot. That's excellent. 85% faster than just looking at current monitor reading and thinking, oh, these numbers don't look that bad.
Actually, that 85 was better than some of my test grades in nursing school.
I will use the word most here. Better than most.
That's right.
Fine.
Okay, so here's what we want everybody to do then, okay? Next time you're in clinical or you're just even practicing some of these trend style questions, try this. Before you look at any of the answer choices, analyze the trend using the 3-point rule. Just make it a habit.
Yeah. And please make sure that you look at all the tabs. Don't skip anything on that screen. You're going to read the admission note. You're going to check when interventions started. You're going to compare the vital signs over time. the more you practice reading patterns instead of just reading numbers, the more natural it becomes.
And I bet the better nurse you're going to be.
Absolutely.
Okay, so before we wrap this up, I want to know, did walking through this question help? Did you like it? Let us know in the comments. I mean, we love doing this, don't we, Ashley?
Oh, yeah, for sure.
Yeah, at Hearst, we love breaking down questions.
Yeah, this is exactly what we do, too. One of the things that I love about what we do at Hearst Review is that we do it all. We make sure that it's comprehensive. We review the must-know content, provide thousands of questions to practice, and we also make sure that students understand the why, because that's really important. Now, not just memorization, guys. Real clinical reasoning that prepares you for the NCLEX and for being a safe and confident nurse.
And I love that approach.
Yep.
That's probably why we took Hearst ourselves, huh?
Yep. That's right.
Okay, y'all. So here's the truth, okay? Your patients cannot always tell you that they're getting worse. I mean, at 12 o'clock, this client in this question was flushed. They were shivering. They were slightly restless. Now, she never once told us, I feel like I'm deteriorating.
Right.
No. Okay, sometimes the patient doesn't even know it themselves. So in today's question, their vital signs were telling us the story. That's what we had to look at.
Exactly. Your job is to learn how to read it. Okay, you're going to need to master pattern recognition, but again, using that 3-point comparison rule, and you're going to be the nurse that catches problems before they even become a crisis.
That's right. You'll be the one that says, something's just not right here, while the other nurses are like, what in the world are you talking about?
And most importantly, you're going to be the nurse that keeps patients safe. And at the end of the day, this is what this is all about.
I love it. Yes, we want you to be a safe nurse. Absolutely. All right, everybody. If this really did help you, please share this with your nursing school friends who are struggling with trend questions too. We want to help everybody.
And drop us a comment. Okay, what other NCLEX question types do you guys want us to break down? We would love to do that in future episodes.
We do love this. So just remember to look at all the information. What story is it telling you? In other words, keep thinking like a nurse.
That's right. Until next time, future nurses,
current nurses,
and retired nurses. Thanks for tuning in to the Nursing Navigator by Hearst Review.
Guiding you through from school to the floor, nursing news, careers, and so much more. Learning, growing, passing the test. With Nursing Navigator, you'll be your best. Nursing Navigator's here.